Hello everyone, I'm David from the Rotary Club of Brisbane. One of our service projects is going to be with Mission Rabies, and we have a special guest. Can you tell us who you are?
My name is Gareth Thomas and I'm Director of Education at Mission Rabies.
Excellent, thank you for joining me. Can you tell us what is rabies?
Okay, so rabies is probably one of the oldest viruses known to man. So it was recorded in sort of Sanskrit texts going back thousands and thousands of years in India. But it's still something that's a very modern problem. So it still kills about 59,000 people every year. Those are the estimates. And while huge amounts have been done, I think fortunately you have never had a problem with rabies in Australia, but huge amounts have been done to push rabies back in Europe, really since 1990 to control rabies in Europe and in Latin America and Central America. It still affects huge numbers of people in sub-Saharan Africa and southern and southeast Asia. And the majority of the victims are children. And the reason that is, rabies is a zoonotic virus that affects all mammals. But in humans, the majority of cases are transmitted through a dog bite. So an infected dog will bite a person. And the reason for that is primarily because people around the world live with dogs. So they keep dogs in most of the countries we work in for sort of protection, for guarding purposes or for hunting or herding purposes. And within the household, it's normally a child that's tasked with looking after that dog. So that's why the majority of victims around the world are children.
And how fatal is it?
Well, it's the deadliest disease known to man. So it's always fatal. So if the virus will transfer from an infected bite, or it can be a lick on a mucous membrane, so the eyes or a mouth, it will transfer into the nervous system. And then if the virus makes it to the brain and clinical symptoms develop, then the patient will die. It's too late for the patient and it will die. I should say that there's been in the thousands of years we've known about rabies, there has been one documented case of a person surviving. But in my work, it's very important to say it's always fatal, because that's one chance. That's a very, very small proportion. And also what we need to do is often persuade people for whom it's a very difficult decision to get to hospital to get the treatment they need, because it's also 100% vaccine preventable. So if you can, if someone gets post-exposure vaccination before the virus reaches the brain, then you can save their life. And they'll normally need a vaccine, between 3 to 5 vaccines over 21 to 28 days.
Mm-hmm. And what does Mission Rabies do?
So there is a solution to this. So rabies unfortunately affects the poorest of poor people, who often can't make it to hospital for treatment. And we see a solution to this. For a long time, it's been known that you can eradicate rabies in the dog population. So you can't create herd immunity in people, but you can create herd immunity in dogs. So they require one vaccination every year. And you can break the cycle of transmission in the dog population. If you vaccinate over 70% of the population, that will create a barrier that will stop the transmission of rabies, because 99% of cases, I don't know if I said this already, are caused by an infected dog bite. It will break the cycle of transmission from the dog population to people. And it's very simple from a veterinary point of view, vaccinating dogs. I mean, on an operational point of view, it can be quite complicated organizing the campaigns, but we have very, very simple solution. We just need to vaccinate enough dogs. So we focus on vaccination campaigns. We educate children, and that's one thing that I'm interested in speaking to your members about supporting. So we educate children and communities on to save their lives immediately when we start a vaccination campaign. So we make them aware that rabies is fatal, it's very serious. So they're aware that they need to get to hospital in the event of a dog bite. We tell them incredibly important first aid steps. So if you wash the wound correctly, it can reduce transmission by a third. And just again, to underline that they need to get to hospital for vaccination, because for the majority of people who die from rabies, that's a very difficult decision, because that will involve loss of income and maybe paying for, in terms of traveling to a hospital for a day, or loss of or the payment for transport can be a big decision. Mm-hmm. So we explain to them why it's incredibly important they need to get to hospital for that vaccination, and also give them the power to advocate for the right treatment when they get there. We also develop surveillance, community-based surveillance programs. So people, again, because it's a disease of extreme poverty, there's huge underestimation and underreporting of rabies. Because people die at home, they don't make it to hospital, and they're not notified into sort of public health systems, surveillance systems. Often they can also be misdiagnosed as cerebral malaria or meningitis in a lot of the countries we work in. So we develop community-based surveillance systems that use both the human medical and the veterinary medical authorities together in that country, bring them together, go out into the community to try and identify cases. And that's incredibly important, because where we implement that, we identify the true burden of the disease. And for example, in Haiti, where we work with the US CDC and the Haitian government on that, we managed to save the government 60% in human post-exposure prophylaxis, while at the same time identifying 30% more cases at the very highest category of risk. In rabies, there's 3 categories of exposure, and the highest, obviously, you need to get to hospital incredibly quickly. So in all of those cases, we were saving lives.
Mm-hmm. And where does rabies sort of stand when it comes to the media? Is it something that a lot of people know is still out there, that it kills a lot of people?
I think there's an awareness of rabies, and I think there's in sort of pop culture, there's an, rabies, often people know about it, and people think of the aggressive form of rabies, but actually probably the majority of cases are actually the dumb form of rabies, which that's what's often misdiagnosed as cerebral malaria or meningitis. That's will often lead to paralysis. And when in my work, again, in the education work, when we start our education programs, we normally conduct surveys to assess in that community, assess the knowledge of rabies before. And again, it's a very old thing. People are aware of a rabies-like virus. What they're often not aware of is that it's always fatal. And what they're often not aware of is that you need vaccination if you are exposed to it. And what we do is emphasize, often we have to emphasize that maybe traditional medicine isn't effective as a barrier against rabies, so you do need to get yourself to hospital for vaccination. And obviously what we also promote is the importance for those families that own dogs, for getting their own dog vaccinated to protect their family and to protect their entire community.
Mm-hmm. And what do you want from sort of Rotary clubs? How can they best help?
I think to create awareness of rabies, and the fact that rabies still does affect lots of people around the world. And I think it's something that I think in countries like maybe Australia or where I'm based in the UK, because it hasn't been a problem for so long, people don't think it's a problem in the world anymore. And I think what's really important for us is explaining that it really is, for some of the most vulnerable communities in the world, it really is a very big problem. And so awareness is one thing. Support also along the way, if we could have financial support along the way, obviously that's really important, because we're trying to eliminate rabies or eradicate human deaths from rabies by 2030. And we need support to do that on quite a large scale. And I think what's a priority for us at the moment is we need support for an education officer in India, in Karnataka particularly, is a big need for us. But I think longer term, we've also got big plans to expand our work into other areas, into other locations, and any support we could have with that would be greatly received.
Mm-hmm. And you mentioned like Australia doesn't have it. Why is that? Did we ever have it, or is it was eradicated, or?
Sorry, David, I have to apologise in that I'm not a veterinarian, so I'm responsible for the education. I'm not a veterinarian. I think so. For example, in the UK's case, it was that it was eradicated and it hasn't been re-entered. I'm not sure in Australia's case whether it was eradicated. In the UK, it was eradicated through vaccination and hasn't. I think the last case we had in the UK was in sort of the early 20th century. I think was the last recorded case. And obviously, because we're an island, it's possible. We have very strict controls on dogs coming into the country and rabies vaccination, and I imagine the same is true in Australia. Although I have to say that I don't know whether Australia never had the disease or if it eradicated it.
Yeah, because of what you were saying about the kind of the awareness. Because as I said to you earlier, that there were people here who were surprised that it still existed anywhere in the world because they're so used to not hearing about it.
And I think that's because it doesn't report properly to global public health systems, because again it affects people living in extreme poverty. They don't notify to the global health, the sort of public health surveillance systems, and except in the countries where we have developed more proactive surveillance systems, those health systems don't go out to find those victims. And where we obviously there's in India where we work, about 20,000 people die that we know of every year. There are about 4.5 million exposures every year, so that's quite a large number. In sub-Saharan Africa, our flagship project is in Blantyre, and that's because we started working there because there was a Lancet paper, and again it was reliant really on a very passionate doctor who was working, an infectious disease specialist who was working in the Queen Elizabeth Hospital at that time, but he just noticed the huge number of, again, pediatric cases that were coming through to that hospital, and him and a couple of colleagues wrote a correspondence to the Lancet in 2012 about the number of pediatric cases they were seeing. And we started work in Blantyre around that hospital to reduce the numbers of deaths. And thankfully, I can say now that in Blantyre, we've reduced the number of deaths to zero, which is amazing. Which is great. And we're looking to scale up that program nationally.
No, excellent. And look, for those that are going to watch this after we post it, get involved with Mission Rabies. Our club is actually doing a fundraiser for Mission Rabies, so you can join us. Thank you so much for joining us and talking to us about Mission Rabies.
Thank you very much, David. Thank you for the opportunity.